Okay, we are going to conclude our study of osteopathic medicine with a case study. And I chose this case study because I think it illustrates nicely the difference between the approach an osteopathic physician may take to a patient versus a more conventionally trained physician, So in this particular case, we have a 67-year-old African-American woman who has been smoking for 30 years, and she's coming to the office, presenting to the clinic, with a productive cough that's lasted for more than 2 weeks. And now, in addition, she has a fever, and the sputum that she's coughing up is a greenish color. Also, she has pain in the ribs on the left side of her chest, and when you listen to her chest with a stethoscope, you can hear breath sounds, which are the fancy word for the types of sounds you hear are called rhonchi. And that's kind of like it's not a wheeze, but it's like a rattly, wet kind of a sound. So she's got that. So the osteopathic doctor in this case took a careful history and did a physical exam. And after taking the history and doing a physical exam, the physician decides that the differential diagnosis, which means the potential things that this woman could have, could be a tumor, possible tumor, although that's unlikely. But she does have that history of smoking, so it's a possibility. But more than likely, she has an infection, community-acquired pneumonitis. Pneumonitis just means an inflammation of the lungs, essentially. Not quite yet pneumonia, but could be working in that direction. And when you hear those sounds, that rhonchi, that's a clue that that's what's going on there. So the physical exam points the doctor in the direction that this person's got a community-acquired pneumonitis, but also we have to think potentially about a tumor. So they did a X-ray, and it showed that on the left side of the left lung, she had a pneumonitis. In addition to that, they did some laboratory evaluation and found that she also had an increase in white blood cells in her blood, and showing that she's spitting out a lot more of white blood cells. Not spitting out of her mouth, but I use that term loosely, meaning that there's more white blood cells being released into the blood. And okay, so the other thing so all of that, sorry, I'm jumping all over the place. Up to now, this is all standard stuff, right? This would be found, probably would be approached up to this point exactly the same, whether you're seeing an osteopathic doctor or a allopathic doctor or a naturopathic doctor or even a functional medicine doctor. For the most part, all of those people are going to find these same sorts of findings. However, because this is an osteopathic doctor, there's a couple other things that they're going to start to notice on their physical exam. And one of the things that this doctor noticed was that there were pulmonary viscerosomatic reflexes activated in the corresponding spinal region. What a viscerosomatic reflex essentially is basically when there's a localized issue, when there's some sort of stimuli localized on a viscera in an organ, in this case it would be the lungs, that produces patterns of a reflex response in segmentally related somatic structures, which means that you can find, so essentially what happens is problems in viscera oftentimes refer to specific spinal regions. And so in this case, what they saw was there were these pulmonary, that's for the lungs, viscerosomatic reflexes that were activated in the corresponding thoracic spinal region, which means in the thoracic spine, which is the thoracic spine are the vertebrae underneath your cervical spine at the kind of the top part of your spinal column. You know, between your neck, let's say just roughly between your neck and like above your lower back in there. There's 12 thoracic vertebrae. So she had this reflex activation. And that was because of this infection in her lung. So a conventionally trained physician's not going to probably notice that. But an osteopathic person that's trained in manual medicine and is trained in this kind of relationship between structure and function is going to notice that. The other thing that this doctor noticed was that several of her ribs were not moving effectively. So she had a diminished range of motion along several of her ribs, which caused a decrease in the mobility of her chest cavity. And the other thing she noticed was the diaphragm had decreased movement also on the left. So your diaphragm is your big muscle of respiration. It's kind of shaped like a dome, and the diaphragm runs along the bottom surfaces of your ribs. And so she also had decreased movement on the left side. So that's all pretty interesting, right? So that's different for the osteopathic physician. So we have, again, just to summarize, we've got these spinal reflexes, thoracic spinal reflexes activated, which is causing a limitation in her range of motion, and it's causing some tenderness also. And the tissue, and I didn't mention this, but osteopathic physician would also notice that there's tissue texture changes in those regions. Right, so she's got limited mobility, and there's changes to the way the tissue feels. So, in terms of what the doctor's going to do about it, first of all, they're going to start this person on antibiotics immediately, and that would be the same thing that a conventionally trained physician would do as well. A conventionally trained physician would probably stop there. But because this is an osteopathic physician that's seeing this woman that's trained in osteopathic manual therapy, that doctor is going to, in addition, he or she is going to treat the thoracic segments and the ribs with osteopathic manual therapy. In this case, the doctor chose to do a counter strain technique because it doesn't require any effort on the part of the patient, and it's very minimal in terms of invasiveness. She's a 67-year-old woman, so you're always going to kind of have to think about the potential that she may be osteoporotic, but the counter strain is really a gentle treatment. So one of the things that we want to think about, an osteopath would think about, is when someone's coughing a lot, oftentimes their breathing mechanics are disrupted. And by treating the thoracic segments and the ribs, that will help to normalize the sympathetic nervous system activity and increase the efficacy and the ease of breathing. Another thing that is interesting is there's this kind of a big bundle of nerves and lymphatic vessels called the thoracic outlet. That essentially is where the thoracic lymphatic duct passes through the thoracic outlet. And if there's any kind of compression on the thoracic outlet and consequently the thoracic duct, then that would cause compression of that tissue, which would kind of block the flow of lymphatic fluid. So by treating this area, you're also going to potentially increase the flow of lymphatic fluid. And lymphatic fluid is really important because it removes any sort of cellular debris, any inflammatory cells, fluid, extra fluid. That would be definitely present in the case of a pneumonitis. It kind of gets that stuff out of there, right? And it helps the healing process, facilitates the healing process. The diaphragm, probably also, they pay some attention to the diaphragm, which I didn't write on there, but the diaphragm often also gets kind of, the motion of the diaphragm gets kind of messed up when someone's coughing a lot. So they would treat the diaphragm probably as well with like a myofascial release. They'd probably also treat the cervical spine with a counterstrain technique. And then finally, this particular doctor concluded the treatment with a technique called the lymphatic pump. And the lymphatic pump, again, kind of helps to facilitate the removal of lymphatic fluid and helps to kind of open up the airway. I'm gonna post a video on. I found a cool site with a bunch of different osteopathic manual treatments, and I'm gonna post a video on the lymphatic pump. It's just like 2 minutes, and you can see how it's done. And if you like it, you can go and look at a whole bunch of other types of manual medicine therapies as well. All right, so that concludes the treatment. Probably also they would give a antitussive. That's a drug that decreases coughing. And they would also probably give recommend maybe some acetaminophen to lower the fever, and if she's feeling any pain. And then they would, have her come back in a few days to see how she is doing. In this case, the patient did come back in 3 days, and she was much better. So I guess in summary, the rationale behind this treatment is kind of obvious. So she's got an infection, so you need to kill the bacteria, and you're going to do that with whatever modality you have. Being a naturopathic physician, I would treat this person very similarly, except for I would probably start with herbal medicine. I'd probably start with herbs myself, because that would be where I would want to go before I would go with the drugs, just to minimize the strain on the microbes in the gut. So we'd want to kill the bacteria. We'd want to thin out the mucus. That would help. So again, you could use an antitussive. As a naturopath, I would use an herb that would thin out mucus, of which there's lots of them. The great thing here with the osteopathic treatment is these manual therapies, which would really help to essentially normalize the physiologic processes and help the body's natural ability to kill bacteria and reduce pain, and of course increasing the removal of any of these inflammatory cells and all this extra tissue, all this extra fluid that could be potentially lodging in the tissues. So the osteopathic doctor does a good job of kind of bridging, right, helping in the host's natural defense, but also using the osteopathic manipulation. So this is a super good example, I think, of the benefit of osteopathic manual therapies and how they can augment and really potentiate the treatment. So again, if you're interested in the lymphatic pump, check it out. I'm going to put a video up on that, and that will conclude our look at osteopathic medicine. I hope you guys enjoyed that. Keep your eye out for your assignment and or discussion on this week's module. I will see you guys next week. I won't see you, but I will talk to you next week. Next week, in week 4 module, we're going to talk about chiropractic. See you then.